Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Factors affecting recanalization. In factors affecting recanalization, first clips are the best step for sterilization, and through the clips we can also do proper recanalization also. Clips is followed by Fallop ring. The least possible technique of sterilization is cautery. The least possible technique of sterilization for recanalization is cautery, but if it is clips, then it is best technique of sterilization which can be recanalized. Type of anastomosis. Best for recanalization is if there is isthmo-isthmic anastomosis is done, it is best for recanalization. Third, reconstruct more than or equal to 4 centimeters of the tube. There is chances of reversal is also good.
thank you and thank you for watching.